Hello, good morning. My name is Dr. Romo, and we're here now in Puerto Vallarta. And I would like to introduce you to Dr. Jorge Porto, who has been working with me for quite a bit. It's been 10 years now. And we have been working with the aspect of the herniated disc on the lumbar spine and cervical spine with great success. It's a very new procedure. It started in Europe, in Italy, basically, to be more specific. And it's broadly accepted now throughout Europe and some parts of Latin America, like Argentina and Chile. And by now we are pioneers in this in Mexico, as I said before. We've been working together for 10 years, and we have a very nice treatment that could be used, and it's used successfully. So here's Dr. Porto, who would like to give you a little broader explanation in what this situation is with the herniated disc. Jorge, good morning, Dr. Jorge.
Thank you, Dr. Romo. Before you can understand what means when you have, if you have one or more herniated discs, you need to understand before some concept about the structure in our spine. Please join to me and take a look at our spine. Now we can see our vertebral spine is have different species. This name is vertebral bones. Here is a muscular space for muscular, strong muscular. If you can see in the front view, we can see a vertebral bones. In this case, it's a lumbar spine, and between two vertebral bones, this is the intervertebral disc. In the side view, we can see a nerve is born, pays in out for this a little foraminal hole. Please observe the close relationship with the back of the disc and the nerve. When the disc is changed, and in this case looks like herniated disc, you can see what is the reason that the nerve is trapped in this hole, and that is the reason for the pain. For this reason, you can understand now what is the reason for the pain. And this looks like when you have your finger trapped in the door. If you don't remove, you don't open the door, you don't remove your fingers from the door, it's impossible that you fix a problem and you improve in your pain.
By now you heard what Dr. Porto had to say about the anatomy of the disc and the vertebral spine. And by now we understand that this is a mechanical problem by which the nerve is trapped, and if the nerve is trapped, it would be equivalent, like he said, to having your finger trapped in the door. If you don't open the door, there is no improvement on the pain. Now, the treatment that we offer with ozone, that we started many years ago, has the effect of unswelling the disc and decreasing the pain by stopping the pain chain. And normally we apply 3 injections throughout the week or 2 weeks. But now, since we started using a new French product called Disco Gel, we can do the treatment within a week, and the improvement is dramatically. We see results within 1 day after the other. And I encourage you to think about it and, in a way, see your options, because the other option would be surgery, and I don't really recommend it because it's risky, it's very expensive. By which this treatment, there's no risk involved, it's also very affordable, and the results are really, really great. And if you would like to take a look at the links in our webpage to see some testimonials in the matter, I'm sure that you will probably decide that this is the way you want to go. Thank you so much for your attention.